Yes.
Most surprised. That's by the way, an excellent excuse not to come to conference, but about the only excuse. Let that not happen again to you. The most surprised. Gosh, that's a. I mean, look, only because it's very uppermost in my mind at the moment, and it's kind of. It was so unfashionable at the beginning, but I think has now caught the public imagination. I am particularly surprised in the best possible way about the public reaction to our achievements on mental health. Shortly after I became leader, 7 odd years ago, one of the first questions I asked the then Prime Minister Gordon Brown was on mental health in Prime Minister's Questions. And I remember the slightly sort of patronising Westminster Village sort of tut-tutting of, oh, what an odd, quirky question to ask. No one cares about it in politics, kind of thing. And now, I've just announced on your behalf, this morning, the biggest overhaul and transformation of child and adolescent mental health services, probably in the post-war period. We're going to announce in the budget on Wednesday £1.25 billion to transform children and adolescent mental health services, which has been a criminally abandoned and under-resourced part of our health service for far, far too long. It'll benefit 110,000 children. Can you imagine? It is estimated on average in every classroom there will be 3 children who have mental health issues which are not being properly treated. And then, all the stuff that Norman Lamb has done to introduce access and waiting time standards for mental health, which didn't exist before, the money going in to improve talking therapies, the huge £150 million we're now putting into transform help given to people with eating disorders. I mean, anorexia, particularly but not exclusively for teenage girls, is the biggest mental health killer in this country, and we're doing something about it. Now, so that's the thing that has probably surprised me most in there, because when I sort of started going on about this at the beginning, many, many years ago, it really was a bit of a sort of hidden debate in politics. It's now become an issue of mainstream concern. I think that's because of us, and much more importantly, in the coming years, hundreds of thousands of people will be helped who wouldn't be helped without us.